Yes. Yes. Get ready. And once you're ready, you can start. Is your mic unmute or not? Keval Shah. Yeah, unmute. Yes. Right. Yes, please. Keval, once you're ready, you can start. Okay.
Okay, sir. Um, shall I start?
Yeah, of course.
Good morning. I am Dr. Keval, one of the doctors working in this clinic. So, how are you feeling now?
Doctor, um, I am really sorry. I'm not very comfortable. Okay, let me tell you one thing. I do not like taking drugs. I don't want, please.
Definitely, I can understand your concerns, but let me tell you that as you were recently diagnosed with Parkinson's disease and you was prescribed with levodopa. This drug is the best medicine available right now for this diagnosis, and it will not only improve the prognosis but it will also help you further alleviate your symptoms.
Um, okay, right. Doctor, why do you want me to persevere?
Well, the thing is that as you were also having muscle spasms in their left foot, and you were not able to swing your arm in the last visit. So it is better that if you start taking that drug, this you can take control over this involuntary muscle spasms. Also, if you are not taking this medication regularly, then your muscle spasm may even progress into the tremors, which will further complicate your situation. Is that clear?
Yeah, of course, that's quite clear. But I want to ask you some questions. It's a big point. I want to know what is this disease actually? What is the name you told the doctor?
Okay, thank you for sharing your concerns with me. Now I'm going to explain you. The condition which you are suffering from is known as Parkinson's disease.
Yeah,
It
this Parkinson's disease. What is it? What are the reasons why I got it? What causes this Parkinson's disease? What exactly it is? And how does it affect me and my body or my brain?
Okay, I am going to answer your every question. Please be rest assured. First of all, this condition is a degenerative disorder which is mainly affecting your central nervous system, that is your brain and the spinal cord. And also in this what happens is slowly and gradually all your motor skills, that means the coordination between a hands and legs will worsen from time to time. Also, you will not be able to speak properly, and your daily functions will be severely impaired. But as far as the causes are concerned, right now the research is still going on, and there are many causes for this condition. At this moment, we are not able to pinpoint the cause of your condition, as this condition can be linked due to some head trauma which you experienced in the past, or also maybe due to some exposure to toxins. But at this moment, to narrow down the causes is simply impossible as the research is going on. Are you understanding?
Yeah, of course. I want to know if there is anything else that would help me. For example, exercise, or in that case, acupuncture, or massage, or anything like that. Would you suggest, doctor?
I'm glad to know that you're interested in knowing other ways how you can manage your spasms. Yes, so along with the levodopa, the medication which I have prescribed you, I am also going to recommend a referral to the physiotherapist so that he can further help you with your movement, also with the muscle spasms which you're experiencing, and also it can help you in walking properly, and also the referred pain which you are experiencing in all over the body and with the breathing pattern. So how do you feel about that?
Yeah, that's fine, doctor. Thank you for your explanation. Noted all your points, but I am not convinced. I don't agree with you. I am. I do not want to stay on the drug, whatever drug you want to give me, because I have a negative feeling, so I don't want to take these drugs at all. Why should I depend on drugs?
Definitely, I can understand that this might be a challenging situation for you right now. So what we can do is, you can start going to the physiotherapist, and along with that, we can first start with the smallest dose possible of this medication. And if you don't have any side effects, or once you are comfortable with this medication, we can slowly and gradually increase the dose. Also, given your current medical condition and symptoms, this approach is the most medically necessary at this point of moment. Is that okay with you?
Yes, of course. Uh, yeah, okay. What to do? I have to listen to you. You are the authority. So, okay, fine. I'm not interested, but okay. Let me see. I'll I'll listen to you.
It's good to know that you are on board with the proposed plan of action. So I am looking forward to see you in a follow-up appointment, and I hope that you are going to adhere with the proposed plan of action. Thank you. That's it. Take care.
Yes, of course. Thank you very much. Thank you very much. Yeah. So that's very nice. It was a good speaking session, but uh, yeah. So, Dr. Keval, I made some funny comments for you. I feel amused at what I wrote for myself when you were speaking. Yes. Okay, that was a good impact. Your speaking was better than average. It's above average, but definitely not outstanding or not even excellent. You know why? You don't have any feelings, Keval. You don't have feelings. For example, when I am talking, you can feel that I have some concern towards you. I'm talking with feelings. There is some sort of pain or worry or interest or liking or love or hatred. Some sort of feeling is there whenever I speak something, but that feelings are not there in your speech. You are detached from these feelings. You have come out of those feelings. In fact, to tell you frankly, I have written here. What's that? That sweetness is missing. That melody is missing. You're speaking like a machine, monotonous. If you want to listen or you don't want to listen, you get lost to do whatever you want. But I'm speaking. It's not my problem whether you understand, you don't understand, whether you bother or you don't bother. It's not my problem. I came here to deliver the goods. I came here to speak something, and I'm going off with you. I don't mind whether you. It's totally monotonous. That gesture towards the others, to involve the other person in your, to be a part of your program, that was missing. That melody is missing. That fine tuning is missing. And the other point which I have written is, you are speaking like actually taking a stick and beating me black and blue. You're taking a stick and beating me black and blue. That's it. I don't know what to say. You have the subject, but the tone and the intent are equally important. What is your intent? What is your intent? That creating an assurance in the patient, creating that you have compassion towards the patient, passing on a message of love and open heartedness, outstretched hand, readiness to help them. These you are not showing it to the other person. You are just a mere messenger or a postman, that's all. You don't know anything about what is in the letter. You're just delivering the post letter and going off. That's it. Like a delivery boy. For example, if you tell somebody, if you write in a letter something and give it to the postman has no feelings because he doesn't know anything about, he doesn't take it seriously. Just one more letter, finish like that. One more speaking like that. But if you speak to your brother or your friend or your mother, in every sentence you have that feelings. So that feelings part is missing because you're speaking with your brains and not with your heart. Because feelings come from your heart. Because of that, it is average. But if you put your heart into your speech, then you will get A grade for this speaking. Definitely, no doubt. There are many students who got. That very essence is missing. Because anyone can speak. But creating the other person and make him understand, make him appreciate, make him that understand that you are his well-wisher, make him convince with love and affection, not with authority, matters the most. And next, one fatal flaw for you was, because you have already passed the test, I don't have any doubt. You will clear your OET speaking, there is no doubt. But now I'm bothered that you have to get A grade. Yeah, Kiran Kaur, if you want to take a speaking session, message me on WhatsApp and be ready. Just message me so that I'll be ready for you. So, also, if you also if you also if you want, you're cutting the sentences into bits and pieces. Also, if you, that means the continuity is broken down into bits and pieces because you're cutting down your sentences. The other person also will cut down his understanding, so he will not be comfortable. The next, there are some pauses and breaks here, and then you are using that, you're overusing that, overusing. Many times you are using that. I want to tell you that You should know that. It is important that. So that is overused. The next, you are rushing, as if a lion is behind you and you are running for your life. If you don't run, you cannot escape the clutches of the lion. Just rushing fast like a marathon runner. Slow and steady wins the race because you're not speaking for yourself. You're speaking for the other person to understand. Mind you. At the end of the day, the other person should understand what you are speaking. Otherwise, it is just muttering. If it doesn't understand, it's nothing more than muttering or gibbering. So, do not rush very fast. If you're slow and steady, you will win the race. You'll win the heart of the patient. Don't just focus on passing on the message. Focus whether the other person can understand your speed or not. So control your speed a little fast. You land into accidents and injuries. And sometimes your mind will not generate the sentences as fast as you are using the sentences. So the mind generating the sentences and the mouth speaking those sentences should be parallel. If your mind thinks slowly and you're speaking very fast, don't say fastly. There's no word in English called fastly. Many people say fastly. So then you will be out of generating words because the mind is slower than you are speaking. So you'll have to wait for 2, 3, 4 seconds so that the mind will generate. So that is a gap, a lag in your speech. So if you're a little bit slow, mind and mouth will go in coordination. That's important. And one sentence, you were prescribed with levodopa. You were prescribed with levodopa. What do you mean by with levodopa? You were prescribed aspirin with levodopa. That means both together. But you are prescribed with levodopa. What do you mean by with levodopa? What with levodopa? Prescribed what with levodopa? I told you to go with John. So you with John. You're saying you were prescribed with levodopa. You were prescribed levodopa. That's all. No need with. When you're saying with, that means something else is there with that. I was prescribed intravenous injections in addition to something else. So with something else. So this and that means in addition to, along with. Something is there along with. You, along with him, come here. That means both of you come here. So that means there are two things. Be careful. Don't use with prescribed. If you're saying with, that means you have to give two things. Okay. Right. So, Keval Shah. Yeah, you can
Yes,
share your experience. What did you learn?
yes, sir. So as you told me that I'm using the word that too much. So instead of like, what can I replace that with actually? What can I replace that?
Yeah, once again.
Yes, sir. As you told me that I'm using the word that too much in my speaking. So
Hmm.
like, how can I improve that, and what other words can I use other than that?
Oh, okay. I tell you that medications are important. I tell you that, I reassure you that medications are important. Just to say medications are important.
Okay.
That's it.
Yes, sir.
You should know that reducing alcohol is important. Reducing alcohol is important. Why you should know that? That's why you are telling, na? So that he will know.
Yes, sir.
So there is no need of an introductory sentence in the first place. The doctor told that you should do regular physical activities 15 minutes on a daily basis. The doctor told that. Why the doctor told that? Doctor only will tell. Correct? So no need of that introductory. If he has a doubt and asks you, then these are the recommendations of the doctor. Otherwise, you can remove that. Say, the doctor recommendations are, the doctor told you that you should do 15 minutes walking every day. Remove that. The doctor suggested 15 minutes of walking every day. Is that clear, my dear?
Yes, sir.
There is no need. There is no need. You're actually beating around the bush and just making a bubble gum out of nothing, chewing gum. It's expanding, that's all. There is no use. Brevity is the name of the game. Is that clear?
Yes, sir.
Right. Yes, this is Grandmaster class, and I am Peter Simon with you. This is the way how we deal with our students because they are of utmost priority. We don't bother getting them 350 marks because our students are very precious for us. We target not just 350 marks. It should be, the target should be 450. The target should be A grade. If not, at least B plus, 400 plus. If you are serious, if your intention is to clear OET in the first attempt itself, if you have time, if you are genuinely have fire in your heart, and crack OET in the first attempt itself, be it speaking sessions or writing reviews or listening lectures or reading sessions, whatever your requirements are, Grand Master class is there for you. Contact us for subscriptions. The number is +91 98778 67360. I repeat, +91 98778 67360. The tagline: call us only if you are extremely serious, because these are serious sessions. This is Peter Simon with you, an expert in English language skills, trained from Cambridge University, masters in English language and literature, and masters in education. We will provide the best learning opportunities. Thank you for viewing this session. See you in the next session. So we have done 3 speaking sessions so far. One is Akshaya Sanoj, second one is Umatoya Toyin, and the third one is Dr. Keshav Keval, Shah, medicine. All right. So that's the end of the session.